Welcome back, everyone. Welcome back to session 2 of day 2 of the webinar, Pandemics and Natural Disasters, Understanding and Coping. Now, I request Dr. Shomrat Roy, Professor of Economics in the Commerce Section, Morning, St. Xavier's College, Kolkata, to introduce formally our next speaker, Professor Arjun Chakraborty.
Thank you, Ankita. We are honored to have with us our next speaker, Dr. Arjun Chakraborty. Dr. Arjun Chakraborty is the Professor of Economics and currently the Director of Institute of Development Studies, Kolkata. Dr. Chakraborty specialized in development economics and political economy, obtained his PhD in economics from University of California, Riverside, USA. He has published widely in the reputed journals, namely Economic Theory, Social Indicators Research, Journal of Quantitative Economics, Environment and Development Economics, Economics Bulletin, Economic and Political Weekly, and others. He has also co-edited 3 books, and also he has co-authored the recently published book, Limits of Bargaining Capital, Labor and State in Contemporary India, published by Cambridge University Press 2019. So, sir, we are extremely delighted to have you in our midst. So we request you to enrich us with your insights on the theme of today's webinar. Thank you, sir.
Thank you. Shall I now switch on my video?
Yes, sir. You switch on your video.
Okay. Thank you very much, Samrat, and I'd like to thank the organizers, especially Arthur and others, for having invited me to this webinar on COVID-19 pandemic and disasters and the consequences of that. It's difficult to speak after Professor Ajita Rai Choudhury because he has covered such a wide range of issues, and almost nothing has been left out. So my job has become really difficult. But I'll try my best. I'm trying to sort of reorient a little bit so that it won't be a repetition of what Professor Rai Choudhury has already said. But for the sake of comprehensiveness of my arguments and the interconnections of the arguments, I would definitely touch upon some of the issues which Professor Rai Choudhury has already discussed. Let me share a few slides I have, so I'll share them here. Okay, so I have thought about this title of my talk, Muddling Through COVID-19. It's muddling through, but muddling through has a kind of positive connotation in the sense that we have already muddled through. But for many of us, it's not yet. So, but still, it's muddling through. So that's why I thought that I'll start off with this kind of uncertain and fuzzy kind of territory. Because Ajita has already pointed out that much of it is extremely uncertain, and we really don't know what is going to happen tomorrow. So anyway, so let me start off with what we know so far and the future trajectories, and mainly I'll focus on a select number of aspects as far as the policies go. And since our main interest here is that how we can sort of cope with this tragedy, I would say, and the consequences of that on the economy largely. And so I'll talk about those things and especially the political economy side of it. So that just to make my product slightly differentiated from Professor Raichoudhury's presentation. If we just sum up the features of India's dealing with coronavirus, you can sum up in 4 or 5 points like this. First, I would say in March, we saw that nationwide lockdown, which was at a relatively early stage of its outbreak. Unlike many other countries, in fact, India imposed lockdown. Now, this is fairly accepted by many commentators that it was a relatively early stage compared to most of the other countries. And of course, it slowed transmission somewhat, but what is to be emphasized is that it didn't flatten India's infection curve, because the curve now we know that it is rising slightly later than what might have happened if we didn't impose lockdown. So it slowed transmission somewhat, but it didn't flatten India's infection curve. Third point that I would like to emphasize here is that, again, this is well known. Just to sum up what happened after lockdown, the lockdown pushed India toward its first economic contraction in over 4 decades. So this is the first economic contraction that we are going to experience. Never happened, for many of, in the lifetime of many of us, leaving millions jobless and forcing the government to ease curbs. So in other words, again, that kind of, even though the curve is rising, but again, going back to that kind of lockdown, which we started with in March, it's not possible anymore because the government is under pressure to ease curbs. Next point I would like to say is that what is the current status? So just yesterday, if you look at the numbers, daily cases have since spiked to 29,000. Since March, the daily cases have increased to 29,000. Every day, actually, it's increasing at an increasing rate, taking the total tally past 8.5 lakh, trailing only the US and Brazil. Until recently, it was trailing behind US, Brazil, and Russia. Now, we have surpassed Russia. So now it's US, Brazil, and third position is India's. And the cumulative death toll has reached 22,000. Now, these absolute numbers, in fact, sometimes, we find it difficult to get unless we put it in relative terms. Now, if you put them in relative terms, I have just picked up the key numbers here. If you just look at the first 3 and Russia, which was the third until recently, you'll find that India's total number, of course, compared to USA, it's much less. Deaths, again, it's not, compared to Brazil and US, it's less. And cases per million, if you look at cases per million, it looks pretty low, 616 compared to Brazil's more than 8,000 and US's 10,000. So it's a cases per million population. And again, if you look at deaths per million population, that's also low. Now, until recently, we are just looking at these figures and we are saying that, still the death rate is pretty low. And compared to some of the other prevailing diseases that we have had so far, like tuberculosis and others, uh, COVID fatality is not that much. So that was the kind of wisdom, shared wisdom that we had until recently. But because of the, this exponentially rising number of cases only recently, now we are getting scared in the sense that because every day uh, it's putting pressure on the healthcare sector, the infrastructure of the healthcare infrastructure, and we hear these horror stories about the patients not finding out beds, not getting beds in either private or government hospitals. So all the hospitals apparently they're running out of beds very fast, and so that's scary now. So many people have, I mean, now the people are generally scared of this possibility that maybe tomorrow if I fall sick, I won't get admitted in a hospital. So this is something that, so in other words, even though cases per million, or uh, number of cases, it's not the highest, and per million cases, uh, uh, rather low compared to US and Brazil. But in terms of the case load, or in terms of the pressure on the country's healthcare infrastructure, it's tremendous. I mean, because we already have had very modest kind of healthcare infrastructure, and these increasing number of cases uh, uh, putting a lot of pressure on that modest healthcare infrastructure. So this is the thing to be worried about. It's not the number per million as such, but again, it's the pressure on the healthcare infrastructure. So if we cannot cater to the increasing number of cases who come to the hospitals for treatment, then probably the death rate may also shoot up. So this is the kind of fear that we have now at the moment. So this is just the today's newspaper that I found that this is very interesting. This particularly just the top left-hand box, that India's share in global cases. Now, India's share in global cases, if you take this 3-day averages, then you find that from June 12, now June 10, 9, 10, 11, sorry, July 9, 10, 11, you'll find that it's close to 12%. That means from 8% to 12%, which means that India's share in global cases, that's increasing. So which clearly means that the rate at which the global numbers is increasing, India's rate is higher than that. So India's number of cases actually is increasing faster than the global average. So that's the conclusion that one can make from today's these figures. So, so if it goes like this, then we don't know really whether the kind of predictions that some of the epidemiologists have made, that maybe will reach 5 lakh or so deaths, sometime end of July or whatever. So all these predictions are around, and many epidemiologists are using their different models to sort of predict the number of cases and number of deaths in near future. So I would just stop here, that about the trajectory of the pandemic, and what may happen in future, because the future is always uncertain. We never know, but still, given the past trends, we can say that our country's healthcare infrastructure is now almost like, or it has almost reached saturation, in the sense that more, it would find it very difficult to accommodate more and more numbers. So this is the kind of conclusion that one can make from these numbers. So continue with these features. So in other words, lockdowns, on the one hand, this further lockdown would be too costly to continue, and the surge of new cases every day too overwhelming to implement any kind of strategy which were useful earlier in a context of smaller number of cases. Taste and trace strategy kind of thing, which early on Kerala actually in fact was successful in containing the spread of the virus, basically by these kind of strategy, taste and trace strategy. But at that time, actually, the number was pretty small. So that's why they could do it. But now, given the surge in the number of cases, it's very difficult, almost impossible to implement that taste and trace strategy kind of thing, is contact tracing, what they call. The second point that what we have already observed is that, again, it's not, I'm not talking about March, April as such, but more recent, like June, July, what we have seen. As migrant workers return to their villages, infections have begun to spread in poorer and more rural parts of the country that have even less healthcare infrastructure. So in other words, even if the number of infected cases as a whole in rural areas still much smaller compared to the urban areas, but given the health infrastructure in the rural areas, again, I mean, we can see the kind of problem that we may face. Some people point out this reported fatality rate, which is among the lowest. It's less than 3%, close to 3% to 2.9% to 3%, which is not very high. That means, given the number of cases, the number of deaths, the percentage of deaths given the number of cases. So the fatality rate is not very high. So, and in fact, sometimes the government spokesperson, in fact, points this out and says that we could contain the spread of the disease, and that's why the fatality rate has been kept low because of the early lockdown. Now, that's a matter of debate, that whether early lockdown actually helped us to keep the fatality rate low, or it is the demography that is so low death rate may be a function of India's young population, because compared to US, you'll find that the death is mostly confined to the elderly, middle ages and elderly people. And so here, since as a percentage of total population, the elderly population's percentage is lower compared to developed countries. So maybe that's one of the reasons why the total absolute number of deaths is low. So these are the debates and discussions in the public forum that you come across every day in the newspapers. So my focus would be that, again, I mean, drawing on what Professor Raishuduri has already discussed. So what are the challenges? Now, again, I mean, economists usually love to talk about trade-offs. So here we have to put the challenges in terms of trade-off. That means if you want to do something, then you have to forego something. So if we want to stop the spread of virus, then we have to forego something, which we have already done. That is, strict lockdown actually had a tremendous negative effect on the economy as a whole, and also the livelihood of certain groups of people. So it's ultimately, it's not, some people in fact initially put it as a kind of lives versus livelihood. but it's not actually, in a sense, it's not just livelihood, it's lives again. So when you lose livelihood and you are pushed to the wall, and then again, I mean, it's a matter of life and death. So it's basically lives versus life rather than, lives versus livelihood. So that's why the trade-off here again, I mean, what kind of trade-off that we have in hand? It's basically, uh, well, I mean, one might say that the first lives actually, it's all over. That means, it doesn't, it's blind to the classes, and including Amitabh Bachchan. That we have seen that it's very unfortunate that yesterday the Bachchan family, particularly Amitabh Bachchan and his son, they're also affected. So this, infection actually doesn't discriminate. But the second lives that I'm talking about, that's the consequence of the lockdown and the economic devastation. And this devastation, in fact, of course, you would all agree that its impact actually falls very disproportionately on different groups of people. So here so lives versus lives. So again, I mean, it's a distribution of life and death across different socioeconomic classes, which I think is the most important aspect or most important, one of the most important challenges of this pandemic. So a strict lockdown early on, causing economic suffering without flattening the infection curve later. So because of this, has India had the worst of both worlds? That means right now we are seeing almost exponential growth in the spread of the virus. And because of the strict lockdown early on, now we see that the kind of devastation that our economy has experienced. So it's kind of the worst of both worlds, it seems. And so the challenges are all the more, difficult because of these, two bads together. That means we have already passed through that lockdown, but still we are still coping with recovery of the economy, which resulted from that lockdown. And at the same time, we have not been able to contain the spread of the virus. So it's like, it's a kind of uh, dual or double kind of burden that now we have been facing. The healthcare system it's becoming overwhelmed in the cities hardest hit by the virus. Look at Mumbai and and entire Maharashtra, several cities in Maharashtra, Ahmedabad, and Delhi, and to some extent Kolkata, now Bangalore. So most of the cities, even big cities, I mean, they are the most vulnerable and they are the hardest hit by the virus. Now, one way of looking at these questions would be that, okay, how important is the question of weak preparedness? That means, was it that we are not prepared enough for this? But you might say that no, look at all the countries around, more than 200 or so countries, all of them are affected. Of course, of different degrees, but some of the most developed, I mean, some of the richest countries, I mean, like USA, is also deeply affected by this. So what do you, I mean, preparedness, what do you mean by that? That so none of them, in a sense, none of them was prepared for this. So it's a kind of once in lifetime kind of pandemic. So, but again, if you really look hard into this preparedness question, then some of the uncomfortable questions would definitely surface, would definitely come out. The first I would like to point out this underinvestment in healthcare. Now, this is again pretty well known among those who look at the healthcare and budgetary allocation and the percentage of government expenditure on healthcare and things like that. It's pretty well known to them that we haven't had enough mm, public expenditure on healthcare. And that's why it's no surprise that the healthcare infrastructure is inadequately prepared, not only just for coronavirus, because it's a very different kind of, and it's very difficult to cope with this, but even for other kinds of spread of epidemic, we really doubt how prepared we are in terms of the healthcare infrastructure. I'll spend a little bit more time towards the end because, since Ajita would focus mainly on macroeconomic issues and also the labor market issues and other issues, policy issues. So I'd focus more on, as Ajita would also suggested, and I take his suggestion that maybe I'll spend a little bit more time on this social sector part of it. So that's why I identify these two as very important issues, that investment in healthcare and lack of social protection for workers. And I'll spend a little bit time on this also. I'll come back to this point. The third point that I'd like to mention here, that slowing down of the economy before the pandemic hit. Now, this is something that is very peculiar to India alone. I mean, the economy actually slowed down. I mean, just immediately after the lockdown, these mass of migrant workers going home, returning to their villages, and this entire thing actually completely sort of unsettled the whole economy based on interstate movements of labor and things like that. So it's things actually started being unsettled right at the end of March itself. So this slowing down of the economy happened, in fact, even before the pandemic hit. But that was also due to the you can attribute that to the continuation of the slowdown, which actually we have been experiencing in the past couple of years. I mean, at least 2 years. So in other words, this slowing down of the economy before the pandemic hit, even in March, in February, in January, in December, we are really worried about the declining growth rate of the Indian economy in the last quarter. I mean, the quarter before the last. So the quarter before the last of 2019-20, the growth rate reached something like 4.2 or so. So that was a significant decline from the earlier growth rates. 6 to 7 to even 8% we reached at some point. So in other words, the slowing down of the economy happened much before the pandemic hit. It's not just immediately before the pandemic, but much before that, and which Ajita Huda has already discussed in detail, that the demand constraint and things like that. So I think that actually imposed further burden on the state, sort of to cope with these economic consequences of the pandemic. That in a slowing economy, now when the pandemic hit, again you are less prepared than what would have been if you had a higher rate of growth. Now, what are the responses from the state after this? Again, I mean, it's all well known, but just to sort of go over this again, once again, but I'll just try and point out something which Ajita Huda didn't discuss. So actually, I'm trying to find things which Ajita Huda has not discussed, and it's so difficult. But again, I'm trying hard to do that. Uh, what are the responses? The major response that you have seen is that what is called Atmanirbhar Bharat vision package, the 20 lakh crore, which amounts to 10% of GDP. And Ajit Avoda has already discussed that in detail, that these 10% of GDP, actually, if you see that it's a, it's a transfer of fund directly, or direct transfer of funds to people, that amounts to only 1% of GDP, not more than that. But the rest is basically, it's in the form of what might be called liquidity infusion in the system. Now, liquidity infusion in the system through the banking system mostly, uh, and also other systems, but bank and financial institutions. So this liquidity infusion through the system, financial system, that's the major part, major chunk of it. It's almost like 9% of GDP is basically on that. Only 1%, you might say that it's, and the details actually you can get it, that first tranches and first tranche and second tranche and all these things, and all the details are there in that policy document. And if you just analyze that, if you just look at that, and you yourself can identify that what are the items which are actually even there is an item which is basically corporate tax cut and tax concession, which is also included in that 20 lakh uh, crore kind of package. So in other words, this is not real sort of transfer of fund to people, that in the hands of the people, so that immediately it gives rise to demand. But of course, Ajit Avoda also cautioned us that if you just give money in any form, like just transfer of cash to people, you can't expect that immediately it would boost up the economy through the demand route. I mean, of course, theoretically it is, theoretically yes, but it may not immediately translate into higher rate of growth. Why? There might be some supply side structural bottlenecks as well. So in other words, even though the basic problem is it's demand, and most of us probably would believe that it's on the demand side the problem lies. But still, once you start you know implementing some kind of direct intervention to boost demand by cash transfer, then you can't expect that immediately the economy would jump to a higher rate of growth. So because of other kinds of structural bottlenecks and all. So we'll talk a little bit about that, what kind of constraints or bottlenecks that might be there even after sort of transfer of cash directly to people. So if you look at this 9%, of 20 lakh, something like even more than 18 lakh actually, and that's entirely that has a philosophy. The philosophy is that it's going to boost investment. But if you go back to this just last year, CMI's outlook for 2019, CMI's outlook, it says that private corporates show no sign of fresh investment in capacity creation due to the existence of excess capacity in industrial sectors and falling returns on investment expenditure. So in other words, it was already recognized in 2019, not by the government as such, but it's CMI's prognosis that private corporates may not boost its investment simply because there's new capacity creation they don't want because of existence of excess capacity which is already created in the industrial sector. So it is already well known that so now I mean, what happened in between, or particularly after the pandemic struck? Uh, what happened that the government suddenly has started thinking in terms of uh, boosting investment through this route, rather than the demand route. Now this is kind of curious that many of us we wonder, and Professor Raichaudhuri has also sort of he has made very critical observations on that. So it's quite well known, and many economists have commented on that. That what actually prompted the government to look at the entire thing from a kind of what is called supply side measure. Now, supply side measure. Well, I mean, I think that there was a question after Ajita Huda's presentation from Saraswati that there is a lack of clarity on what should constitute this supply side measure. Now this is typically theoretically supply side measure. That means you are directly sort of giving incentive to the investors to invest in the economy, bypassing the kind of demand route. That means it's not, no matter what happens to demand, if you give enough incentive to the investors, the investment would be forthcoming. So that's the kind of assumption that they're making, which means that this is what we call supply side economics. That means but sometimes you confuse this with heavy public investment in infrastructure. Now, public investment in infrastructure, I mean, from macroeconomic point of view, or from macroeconomic position point of view, supply side position and demand side position, I won't call it supply side position as such, because if I sort of advocate heavy public investment in infrastructure, it is something like the old development economics of Albert Hirschman kind of idea, that balanced unbalanced kind of growth path. That is, this social overhead capital versus directly productive activities, DPA and SOCs. And so you first you spend make public investment on SOC, and that would bring about private activities. Now this is a very classic kind of public sector taking over as the kind of commanding role kind of thing. Now in a sense it's a supply side boost, but this is not typical supply side position that macroeconomists talk about. So I would like to make a distinction between the two. So even today, instead of giving direct cash to individuals, some might argue, even Ajita would also argue to some extent, that these job programs like MG and LGA should not be just cash transfer as such. It should be linked to some building up some productive capacity, like social infrastructure. Now that's a very, I mean, that's a problem which is well taken, that it should not be just cash transfer, but it should be aimed at creating certain social infrastructure. And of course, I mean, there is no conflict between the two. That means direct cash transfer and direct cash transfer for building up your social overhead capital. There is no inherent conflict between the two. But if you insist that we are going to introduce some of the incentives for the investors, for the corporates, in the form of even tax concessions, and in fact these tax concessions are included in Atmanirbhar Bharat Abhiyan package. So in other words, it is very much classic kind of supply side position. So in other words, the kind of wisdom that has gone into this kind of stimulus package is sipped in a kind of supply side position, no doubt about it. And moreover, if you look at this item wise, the list of items under this Atmanirbhar Bharat Vision package, you'll find that this the liquidity infusion in banking system that they're talking about, which is already in place. Some time back in, I think, 2015, uh, the the government of India started this Mudra scheme. So Mudra scheme actually was supposed to give small loans to MSME sector, and huge number of loans actually were made during 4 years time. 2015 to 2019. If you look at these Niti Aayog figures, you'll find that it's a huge, in fact, almost like uh, I don't remember, maybe 4 million or so enterprises actually got this loan. So so this Mudra was already there, and so these kind of loans at concessional rates to the MSMEs. Now these things are already there, and banks at the same time they are really struggling for funds. So that's why this liquidity infusion into the banking system that happened early on. I mean, before the pandemic hit. So this 20 lakh crore package actually includes that part also. So in other words, in real terms, you don't see much fresh sort of infusion, even in terms of this liquidity infusion in the system. Uh, of course, I mean, there is 50% of that probably, but the rest actually either in the form of tax concession or in the form of this already existing liquidity infusion, that kind of thing. So in other words, this is the kind of response that we have seen from the government of India. Uh, Again, Professor Rai Chaudhuri has already spoken about, apart from this 20 lakh crore stimulus package, he also spoke about the monetary policy interventions. And we have seen this. So on the one hand, you have announced an ineffective stimulus package. I mean, the stimulus package is bound to be ineffective simply because the economy is still suffering from demand shortage, not supply side incentive. Otherwise, I mean, the investors are not investing simply because demand is not there. So it's as simple as that. So so the stimulus of the kind that the government of India has announced or uh, has offered, it's largely ineffective, uh, and at the same time we see that uh, we see that at the same time we see that the RBI has announced has been announcing rate cards successively. Uh, and Arjun has already explained that these kind of monetary policy actually doesn't work during this time, because even if the rate of interest is lower, but still investors won't be interested in investing simply because demand is not there. Uh, so in other words, the to sum up this the policy responses so far, there's this huge glaring absence of much needed fiscal stance, the fiscal part of it, not the monetary part of it. So the kind of fiscal policy that we expected and any economist would expect during this situation, but that fiscal stance is totally absent in this kind of announcement of this package. There are little bit here and there. I mean, bits and pieces here and there. Uh, for instance, in the package itself, it's mentioned that the states now can borrow an additional 2% of their GDP from the market, uh, which is 2% more than what the existing 3% limit. As you all know that this FRBM Act, which the government of India passed some time back, Fiscal Responsibility and Management Budgetary Management Act, FRBM, and that actually stipulated 3% of GDP as the maximum budget deficit. And so the states now can borrow more. That is what they have suggested in that package. But I mean, there are fine prints there. Of course, I mean, these kind of, allowing states to borrow when the states are actually expecting, a kind of disaster grant from the center. Now, instead of grant, you are allowing them to borrow more. But again, I mean, there are fine prints there because the, it's the I mean, this additional borrowing actually you can do if provided you implement certain reforms. I'll come to those reforms. It's very interesting that during the time at the time of this kind of disaster, you are actually pressurizing the states to go through some reform. Otherwise, I won't allow you to raise money from the market. I mean, the states, the only sort of freedom that the states have in this context is that they can borrow from the market at a rate like 8 or 8.5% rate, and they have to repay it. So the interest burden would be huge on the part of the states, but still okay. So that's borrowing. So the center actually has not so far announced any substantial grant as such, grant to states. So but on the other hand, the states bear the larger responsibility in dealing with this crisis, but they have very few resources to do so. And I can go into the details of the kind of resource crunch they have, particularly during this time. For instance, when the economy is likely to grow at a even negative rate, which means that even the center's tax revenue would come down, and the state actually gets transfer from the center from what is called the divisible pool of tax revenue. So the center's divisible pool of tax revenue, which is basically distributed among the states. Now, if that pool itself actually shrinks because of this lower growth and negative growth rate, then obviously the state's share in that divisible pool will also come down. So in other words, what the state actually could earlier get as transfer from the center, now that even the transfer component would come down significantly because the divisible pool itself would shrink. On the other hand, the states, in fact, don't have much leeway in terms of earning revenue. For instance, earlier the states had this commodity taxes like sales taxes, but now after GST, the states have absolutely no freedom to sort of manipulate the revenue that they can earn from the commodities. So the indirect taxes also now it's almost like fixed by the rates, GST rates. So the states are more and more, in fact, in a very constrained situation because of their very limited resources, and also because of this, the uncertainty in terms of the quantum of transfer that they can expect to get from the center. So this is the main point of my presentation. So I spend a little bit on this particular part because Professor Rai Chaudhuri has nicely covered these entire macroeconomic issues in a very lucid manner. And but I would like to, so that's why I would like to focus more on this the center state transfer part of it. If you look at the division of responsibilities between the center and the states, and remember this mainly this management of this kind of pandemic, it's entirely actually falls on the states, and states are responsible for public health and also public order. You know, if you look at the state list of the Constitution, Indian Constitution, the state list of Indian Constitution actually mentions this public order and public health in the state's domain. On the other hand, prevention of the extension from one state to another of infectious or contagious diseases or pests affecting men, animals, or plants. Now, this particular thing is in the concurrent list. So, which means that both center and the state are responsible, the states are responsible for this particular part. That means where this cross-border kind of transmission is involved, like infectious or contagious diseases, then the center has to have a role to play, because of, you know, center has to do some kind of coordination role, just to, you know, control these border transmission. So this is the constitution. So constitution in fact delineates the roles, respective roles of the states on the one hand and the center. But what the state has done since March, it is something like, you see that on March 20, if I remember correctly, just I think 4 days before the lockdown announced, on March 20, there is a meeting with the chief ministers of the states. And in that meeting, in fact, a lot of things were discussed. But the lockdown actually was not discussed in that meeting of March 20. But March 24, we saw this lockdown announced unilaterally by the center. Now, this is very curious. I mean, of course, I mean, you know, in this kind of epidemic situation, of course, the state has the prime role to play here. But, you know, if you could discuss a lot of things on March 20, why not even lockdown or possible lockdown? Or maybe, you know, again on March 24, you meet the chief ministers and then talk about the lockdown. So the lockdown actually was not discussed in the meeting of the states with the center, but lockdown was. So now, how can the center do that? Yes, there is a provision like which is called Disaster Management Act of 2005. So center so just by invoking Disaster Management Act of 2005, the center can actually completely decentralize this entire decision making process, and this is exactly what happened. So what is the justification? The justification is that this is, you know, this is done you know, for reasons of consistency in the application of implementation of various measures across the country. So it is you know, well, it is justified in the sense that, you know, some consistency is needed in terms of what the states are doing. So the center has a role to play. But you know, by invoking Disaster Management Act, what we have seen is that this entire decision-making process has been centralized, and the states actually are at the, I would say, receiving end. So what we have observed is that, so this entire thing actually reduced the state's role to being merely agents to implement decisions handed down to them. So this is, I think this is a major fallout of this the state's response to the pandemic. There are good sides and there are bad sides. So all these things now we know that because pandemic was never anticipated in the, you know, it would take up this kind of sort of uh, I mean, it would have such an impact. We never anticipated. So of course, it's a new thing. But at the same time, it's difficult to sort of justify why the state had to centralize most of these things in the way that they have done. It could be left to the states to decide quite a few things. So I have discussed this third point already, and limited sources of. So this is the last point, which is extremely important, that the center seems to have found an opportunity to impose conditions on even borrowing. And if you go through the conditions, I mean, they are very interesting conditions. I mean, one condition actually says that linking of Aadhaar with these ration cards for PDAs. Now, what does it have to do with pandemic or anything, or even borrowing? So now borrowing, you are increasing the limits limit to borrowing, but at the same time you're imposing conditions on borrowing which have nothing to do with this pandemic as such, which are general kind of basically putting the states on in line with the policies. So which could be done in other times, but why do we put it in as a kind of conditionality on borrowing limits? I mean, that is something which is puzzling, and I have no answer to that. Why the state, why the center actually found this particular time as the opportune moment to impose all these conditions, and these conditions have nothing to do with the pandemic as such. The other point that I'd like to say is that there's the entire philosophy of like it is like first it's a stimulus, and then we saw these reforms. And some of the reforms which Professor Raichaudhuri also talked about, this particularly the labor market reform and all. So what we observe is that during this time, during the pandemic time, the state found again an opportune moment for privatization, for labor market flexibility, and also what they call this, not doling out, but giving credit. So we don't believe in the philosophy of doling out. That is what Finance Minister, in fact, said in one of her speeches, that we don't believe in doling out. So that's why we are providing credit to boost the economy. Now, these three things, in fact, if you look at them together, they sum up the philosophy of reform. And the kind of reform the center actually, the state, the central government actually has found the opportune moment to introduce these reforms. The auction of coal blocks, and gradual privatization of railways. Several states actually have passed laws. I mean, they have brought the bills, and some of them have passed, and some of them it's pending now. And just to make the labor market more flexible, in the sense that labor market flexibility, they only mean that this the freedom to hire and fire kind of idea. That means the if you employ up to 300 workers now, then you can hire and fire at will. That kind of limit. So from 100 workers, it has gone up to 300 workers now. But you see that it's very interesting and almost like funny. If you look at the distribution or size distribution of the enterprises, you see that the last economic census, for instance, and there are very few actually, less than 9%, in fact, as far as I remember, they employ more than 20 workers. So the rest actually they employ less than 20 workers. So it's not that even 300 workers they are employing. So in other words, and here is the puzzle. The puzzle is that if you think that labor market flexibility is the bottleneck, so you are making this hiring and firing, easier for firms employing up to 300 workers. So more than 300 workers, you have to take permission from the government. Okay, so up to 300 workers. So, so, so then naturally you would expect that most of the firms actually would have no problem in growing till 300 workers. But how many firms are there with even 200 workers, even 100 workers? Very few. So this overwhelming, more than 90% of the firms, they are basically employing less than 20 workers. And we know that informal workers and also, in fact, the 72% of all enterprises, they are actually what they call, own account enterprises. Now, what is own account enterprises? Just one person, basically self-employed. So just one person, no worker is hired in those enterprises. Now you can imagine that most of these enterprises, even though they come under what is called MSME, micro, small, medium enterprises, MSME, and all the credit actually, so-called concessional credit, is provided in the name of MSMEs. But who are the firms who can actually get access to these concessional credits? Not those self-employed people or the just one-person enterprises, not even 5% or 5 workers enterprises, not even 10 workers enterprises. Most of the enterprises which actually can access bank credit at concessional terms, they would be, they're likely to be more than 100 or 200. So this is something that is puzzling. That is, in the name of MSME, we always, as if we think in terms of very small and tiny enterprises. But the very small and tiny enterprises, which are micro enterprises, they have no access to credit. In fact, if you look at the data, they have no access to credit. So, I mean, there is no possibility that even after announcement of this concessional credit and all this 20 lakh crore package, there's no way that they can access this concessional credit. So this is the last point, and I would end with this. So this dominant philosophy of reform that we see that, or we call out from the policy statements of the government, is there any way to reorient this philosophy a little bit? If we want to suggest a reorientation in this philosophy of reform, which direction should it take? Now, I have identified a few. One, definitely investment in healthcare, which I started with at the beginning. I mentioned that. And here, in fact, we need a radical reorientation of expenditure. What is this reorientation of expenditure? Already we know that it's very little. I mean, one of the lowest, in fact, as a percentage of GDP that we spend on healthcare, it's around 1.2. 1.2% of GDP we spend on healthcare, which is among the lowest, in fact, among all the countries in the world. So there is no doubt that we have to raise this investment, public investment in healthcare. But again, this healthcare, actually, if you divide healthcare into curative and preventive kind of thing, so curative, most of this expenditure actually is on curative, but not much on the preventive, that is public health kind of infrastructure. So public health infrastructure like disease surveillance, for instance, disease surveillance, or detection, early detection of epidemics. Now all these things require money. All these things require investment. Of course, I mean, there are a few states. I mean, only one state I know well, that is Kerala, where in fact Tamil Nadu also has a different public health department, and the budgetary allocation is actually separated from curative health and given to public health. So Kerala, Tamil Nadu, they have shown the way in the sense that there should be reallocation. More money should go to this preventive healthcare in terms of this disease surveillance and early detection of epidemics and things like that. So reorientation of this expenditure is needed. And moreover, this entire thinking about this reducing the private burden of out-of-pocket expenditure by private individuals, and that itself actually has been overwhelming in the health policy in the recent years. So that's why you see this Ayushman Bharat, which is actually insurance-based kind of system. And we know that insurance-based kind of system, it cannot be very efficient system because it's a high-cost kind of system. And so instead of that, we could have spent the entire public money, which actually we now spend through Ayushman Bharat, that 5 lakh coverage kind of thing. We could do it through public healthcare system itself. Now, we can go on discussing that. It's a matter of huge controversy and debate that, but now I think that after this pandemic, now many people have started thinking about that. And, probably we had gone to a kind of wrong direction in terms of, thinking only in terms of insurance and curative care. Now, probably we'll think more about this other side of the story thing. Agriculture, again, we need some reform. And since agriculture is not much hard, as Ajit Avada has said, but agriculture has its own problems, particularly these marketing and the intermediaries and all, which actually would, in fact, give a kind of dynamism to agriculture, which can absorb some shocks. So absorption of shocks from different kinds of labor markets. So when different labor markets actually go through some kind of shock, then there should be some sectors where actually these shocks can be absorbed. But not just agriculture as such, but social security in general. That means social security for workers actually, I'm not thinking in terms of just doling out as such, but social security is good for the economy. Good for the economy, why? Because social security again absorbs shock. So if the economy goes through any kind of shock like a pandemic, then a widespread net of social security for workers, for citizens as a whole, actually helps the government to cope with the pandemic. So in other words, and we have a lot of research on that, social security, like, earlier this, our expert committee on unorganized sector workers, they made a lot of recommendations in 2007 itself, but very few actually have been implemented ever since. So there is a scope for revamping the social security measures for workers. And the last point that so I'll end with this last point, that decentralization of governance. So already much centralization has taken place because of the pandemic, and some of it is justified. But if we had a thoroughly decentralized governance system, which actually could, in fact, work as a good or functioning delivery system during the pandemic. So this functioning delivery system during the pandemic, in fact, most of the controversies that we see in the present context in West Bengal and the political, all this, trouble that is happening and all these clashes and all, it's entirely due to this, this mismanagement of the delivery of the services at the local level. So a proper decentralization of governance with the right kind of political incentives and things like that probably would actually again work towards just to cope with this pandemic. So I stop with that. I think I have taken more time than I was allotted. Is that so? I stop with that. Thank you very much, and thank you for your patient listen.
Thank you, sir. Thank you, sir, for your insightful speech and also on the detailed presentation on the issue of muddling with COVID-19. Sir, we have a lot of questions. So out of that, we have selected 4 to 5 relevant questions in this regard. So can I proceed with the questions, sir, one after the other?
Sure. Yeah.
Firstly, the questions is basically on the public health management. It says that the statistical comparison between the cases entirely depends upon the number of tests that is conducted. So is it sufficient for the West Bengal at all, given the current scenario regarding the testing that has been carried out?
Yeah, in the table that I showed, I think the number of testing, oh, I forgot that number of testing. No, the number of testing actually is much less compared to other countries, India as a whole. But state-wise testing, again, it varies quite a bit. And there is absolutely no correlation between the cases and the testing at the state level. If you look at the state level cases and testing, not very high correlation between the two. So in other words, maybe because of, in some cases, it's a community kind of spread we see. So there, in fact, the testing would be more efficient than in other places. For instance, now it's spreading to the districts. Now, testing of that kind, in the districts, that would be, very difficult. So you cannot increase overnight the number of testing in the outside the urban areas. So this is so there is a kind of inherent limit to that. But as far as the urban areas are concerned, I would say that yes, the number of testing is less. But so some people say that if we tested more, probably the cases would have been more. But still, the death rate is within the limit, that 3%.
Okay, thank you, sir. So the next question is regarding the allocation of the sectors towards the GDP. It is said that has COVID-19 pandemic not been indicative towards the demand for higher percentage of the GDP allocated towards education, scientific research, and health service?
Yeah, I mean, I just touched upon the health sector, but not education. And so you're absolutely right that this is an area where a lot of people have been talking about this inadequate expenditure on health and education, and including Amartya Sen, he has been talking about that for long. But still, we see that the percentage of our GDP spent on healthcare is still around 1.2. And education is around 3%, 3 to 3.5%. But the expert committees all agree that education expenditure should be raised to 6% and health expenditure should be raised to 3%. Now, coming to these others like R&D and things like that, I think that's a big question. That R&D, for instance, much of this research money actually goes to scientific, money allocated for scientific research goes to DRDO, that is defense research. Now, defense research, almost like 60% of total the money for scientific research goes to the defense research. Now, in fact, we know very little about that, the kind of allocation within that, we really don't know much. So in terms of money going to scientific research, of course, it is less than what should have been. But again, people might argue that, altogether, we are spending only 3% of GDP. So if you want to increase money to scientific research, then you have to cut down on school education or something like that. Unless you raise it, further from 3% to 4 or 5 or 6, then you have to cut down on others. In fact, I did one small exercise some time back. It was published in EPW. I showed that for several years, in fact, if whenever you see that slight increase in expenditure on health and education, you see certain decrease in MG-NREGA. When you see that increase in MG-NREGA, decrease in health and education. So in other words, there is a kind of calculation that, towards this sector, I mean, social sector and rural development together should not exceed a certain limit. So that's why, it's a basically between the tussle between these subsectors within this social sector and rural development. Yeah. But I fully agree that this allocation must be much higher than what we have now. Yeah.
Thank you, sir. So the last two questions are on the policy regards. So for the Indian economy as a whole, is it ever plausible to follow the South Korea or the Germany model? And if it is so, then what should be done?
Uh, South Korea, Germany model. I think Germany model. You mean that the small industry sectors. I mean, they have a lot of innovative ideas about this small and medium kind of manufacturing sector, and well, I mean that's one way, because almost like now, the if you look at our new definition of MSME, government of India has changed the definition of MSME very recently, and increased the investment limit, I think 200 crore or something. And then almost like 99% actually are MSME. Basically 99% enterprises are MSME in India. So I think this entire policy towards manufacturing, it would be MSME oriented. Now South Korea, it would be a kind of state driven kind of export oriented expansion, that we know that, state driven export orientation kind of thing. And for that, actually, you have to really chalk out a lot of incentive schemes in terms of, this making this manufacturing more export oriented. We have already had this debate that make in India kind of thing, and make in India, and people are very pessimistic about that possibility, simply because, we can't compete with China on this, low cost kind of consumer items, because China actually is highly productive on that, and they can make it at low cost. But remember that China is making it at a low cost, not at the cost of labor, because in China, real wages are rising, unlike in India. In India, actually, this for low skilled people, in fact, real wages are completely stagnant. It's not rising. But in China, in fact, real wages are rising. So it's no longer true that China is able to sell at a lower cost simply because, well, labor cost is low. Actually, it is not. So wages are going up in China, but at the same time, simply because productivity is high. So now, how do you raise productivity? Now, as I said, that our 72% of this, just 1% enterprise. How can you raise productivity there? Because most of these enterprises, they are just like surviving. So there's no dynamism at all in these enterprises. So I don't know that, we need a kind of massive program to dynamize this entire micro sector. Small and medium, okay, I mean, some ancillaries are there, and automobile ancillaries, they're very dynamic and all. But micro sector, absolutely no dynamism we can see. And the mortality rate among these tiny little sectors is very high. And, so today the enterprise is there, tomorrow it is not there. And particularly after this pandemic, how many of them would survive, I really doubt.
Thank you, sir. So now the last question, sir, for you. That is, according to you, sir, what can be the proper policy approach to actually hope for a plateau in the curve rather than a delayed ascent that we see now?
I'm not an expert on epidemiology, so epidemiologists would say would be able to tell that. But again, I mean, now people have very little faith on any expert nowadays, because no prediction actually, I mean, has in fact, we have seen that it's happening. So I think that prediction is always difficult, but my personal opinion, if you ask me, I think that our sudden lockdown, that March 24 lockdown, could it be staggered a little bit, so that we could avoid this humanitarian tragedy of these migrant workers going back home, and which we all sort of witnessed that. So maybe a couple of days. I mean, probably that would have been a kind of face saving, at least on lockdown. But lockdown was, I must say, lockdown. If you didn't do lockdown, then people actually couldn't internalize these particular social distancing kind of behavior. So now social distancing, whatever little actually they have internalized because of lockdown. So I cannot dismiss lockdown altogether, but the timing probably, maybe would have been slightly better than what we saw.
Thank you, sir, for your lucid presentation and all the questions you have answered so smoothly that we have understood. Thank you, sir, for your speech and your presence. Thank you, sir.
Thank you, Samrat. Thank you very much. Thank you all. Thank you.
Thank you, Professor Arjun Chakraborty and Dr. Shamrat Roy for conducting such a wonderful and informative session. We hope to hear from you in the future more so. Now, I request Dr. Rayan Chandra, Member Secretary of the Academic Council, St. Xavier's College, Kolkata, to end today's session with his thank note.
Good evening, everybody. We have come to the end of a very enriching two-day national webinar. Now, it is my privilege to propose the vote of thanks. I shall first take the opportunity to thank our resource persons, Mr. Snehashi Shur, Dr. Bhaskar Narayan Chakraborty, Professor Ajitapa Raichaudhuri, and Professor Achin Chakraborty for giving their valuable time and delivering their brilliant lectures. I'd like to thank our principal, Reverend Dr. Dominic Savio SJ, for all his encouragement and unconditional support. I'd like to place on record the contribution of Dr. Arup Kumar Mitro, Professor of Microbiology Department and Assistant Controller of Examinations, St. Xavier's College, Autonomous, Kolkata. Without his generous assistance, the webinar could not have been organized. I'd like to thank Dr. Shashwati Chaudhuri and Dr. Shamrat Roy for smoothly conducting the sessions of Day 2. I shall take this opportunity to express my gratitude to the whole internal quality assurance team and academic council members for their generous support. I shall fail to perform my duty if I do not thank a few young men and women who constituted the backbone of this webinar and managed each and every technical issue with utmost sincerity and efficiency. I'd like to specifically thank Ankita Datta Chaudhuri, Piyash Mukherjee, Swarnika Roy, Suchandrima Bhomik, Biti Chaudhuri, Spandan Mojumdar, and Stuti Borua in this respect. They have really made us proud as their teachers. Finally, I'd like to thank all the participants across the country for attending this webinar. May God bless us all. Thank you.
With this, we come to the end of the two-day national webinar. We thank everyone for cooperating with us, all the participants, and regret any kind of technical issues faced. The feedback form has already been shared thrice in the YouTube chat box, and we are receiving a huge number of responses. So we would request everyone to be patient since delivering of the certificates will take at least 15 to 20 working days. So within 15 to 20 working days, everyone will receive their certificates. If you have completed all the 3 steps, that is filling up of the registration form, continuous active participation in all the 4 sessions, and filling up of the feedback form. Till then, stay home, stay safe. Thank you, everyone.